Hoarding disorder is an actual medical condition found on DSM-5, and there is a show called Hoarders. So I thought we'd watch one of the episodes. Gotta give you a heads up, a lot of poor sanitation will be visualized here. So if you have a weak stomach, just be aware. Let's get started.
There was an anonymous neighbor who looked over the fence and saw the outside.
I'm Sean, and Shanna is my sister. I don't think anything would honestly change if it wasn't for the city posting a thing on the door.
There's a lot of ways to intervene with someone who's struggling this way, but I think it's important to figure out what exactly is going on before we start talking about violations. You have an individual who's living with very poor sanitation, and poor sanitation alone can cause problems from getting frequent infections, allergic reactions, but then there's also mechanical issues here, especially as one gets older. If you have a lot of clutter in a home, it's very easy to increase the amount of accidents you have. These are all things that impact one's health. That's interesting because when we look at research of twins, we actually see that there is some sort of heritability here, where there is a familial pass down, even though we don't know what gene codes for this yet. We've actually tried to look for it, but we've seen a genetic tie to hoarding disorder. We actually have very strict criteria that we use in DSM-5 to diagnose hoarding disorder. Hoarding disorder must meet all 6 of these criteria right here. It must be done in a very strict way, including ruling out other conditions, making sure that there is no medical condition causing these symptoms. We actually used to think of hoarding disorder as part of OCD, obsessive compulsive disorder, but now we've untied them and realized with research that hoarding disorder needs to stand alone on its own. So some of the research we use even to this day is based on the incorrect notion that all the participants that had hoarding disorder were also patients with OCD.
My mother used to put poop in a jug. Actually, by the time you put it in there, it's actually a dirty water jug is what that is.
That's really problematic because from a sanitation standpoint, that's how disease spreads. Fecal matter has a lot of bacteria in it. Things that if it were to enter our skin, our urinary tract, in our eyes, that can cause infection. It can lead to sepsis, overwhelming sepsis, so much so that you could lose your life.
I want to say that the reason that Shanna didn't get rid of all those bottles is because she's lazy. I hope it's not sentimental to her.
That's not medically accurate. Hoarding disorder does not stem from laziness. It usually stems from a distress of losing items, feeling that you might lose out on some value, especially with items that don't intrinsically have value. So it's kind of a misinterpretation, a cognitive distortion, if you will.
There's still some space in the toilet, but I don't want it to overflow. So I've been using a bucket.
I think the house will kill Shanna if she doesn't get out of there.
Like I said earlier, if there's a fire in here, there's a lot of flammable objects that are at high risk for catching on fire. Then also mechanically, you could fall. You could fall into the feces. That's a bacterial infection. You're knocked unconscious, you're bleeding, you're getting infected. That's an easy way for someone to lose their life. Who's Matt?
I'm Matt Paxton. I'm an extreme cleaning specialist. So man, hold on a second. Let me take this in. This house is disgusting. It's hands down the worst smelling house I've ever smelled in my life.
Remember, a lot of the smell is driven by bacteria excrement, meaning when bacteria eat on substances, it actually releases an odor. That's why if you notice, if you wear a cotton shirt to the gym, it usually doesn't smell as bad. That's because it absorbs water, not oil from your skin. Whereas the polyester substances like the Under Armours, the Nike compression gear, all that stuff, that actually traps oils in it. And then the bacteria feed on that, and that bacteria makes it smell much worse. So if you smell someone's gym bag who had compression gear in it, it smells very differently, and that's because of the bacteria being different and what they're eating being different.
Okay, now this is not the worst hoard you've ever cleared out.
Sanitarily, this is a really dangerous house. She's eating 2 feet from all the poop and urine.
Do you think I meet the definition of a hoarder?
Hell yes.
Well, she asked hoarder, not hoarding disorder, but it's important to let a medical professional make that diagnosis. And the fact that she doesn't see this being as big of a problem as it visibly is shows that there's potentially a lack of insight. And depending on the amount of insight patients have, they may be more apt to taking action or allowing others to help them in a situation. And what's unique about hoarding disorder is there's a wide variability here. There's some patients who know this is a real problem, but it's what I have to deal with. And some patients that are saying full on, I don't know, this looks fine. This is how I live.
The more time I'm spending with her, I'm realizing she may not be able to make a lot of good decisions.
What he's pointing out, maybe in not the most subtle way, is that there is a lack of insight into the situation.
What is the main cause of the smell?
Musty odor, having to do with mold and dust.
Yeah, musty odor is a sign for mold. In fact, going in and doing a visual inspection of a home, smelling it, like olfactory senses, like visualization, olfactory, is more reliable than doing spore counts. If you see mold, you don't need to do a spore count. If you smell mold and you don't see it, you can do a spore count. But that goes to show how strong our senses are to mold. It's like a true chemical detector right there in your face.
No.
No?
It's the feces and urine that's in the house.
I don't think this is an either or situation. I think the fire risk, the mechanical fall risk, the feces, the urine, the mold, check, 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 check.
Is that brand new information to you? To think that the feces and urine has something to do with the smell?
I guess so, because I thought it was due to the mold and dust.
Well, perhaps there's some sort of cognitive situation here. I don't know her medical history. It's why I didn't comment on making a diagnosis. If first-line treatment, which is cognitive behavioral therapy specific for hoarding disorder, fails, you get to a point where you actually do some cognitive remediation, where you try and re-educate patients on things like this.
I'm Dr. Robin Sazio. I'm a licensed clinical psychologist, and I specialize in OCD and compulsive hoarding.
This has never been opened.
This is covered in mold.
It might be a little bit moldy because I don't have a freezer.
So the problem with moldy bread is it's not like a moldy berry. If you have a plate of berries and one of them is moldy, you throw it away, no problem. But the fungal spores actually put out their like tentacles, if you will, and go across the whole bread, and you never know which section has mold in it and doesn't.
Everything in the bathroom is contaminated.
The toothbrushes, though, are covered in something plastic.
Nothing in this room can be safe.
Oh boy.
I've never cleaned a bathroom like this.
Remember, when you're manipulating all these materials, you're aerosolizing all these particles in the air. You gotta wear masks and you gotta be careful.
I almost puked my respirator. I had to get out of there. There's hundreds of bottles of human waste. The different colors. Watching it slosh around, it started going through the respirator. That was too much.
If it's going through the respirator, that means the respirator is not well fit, because even when we do our respirator fit testing, they spray certain chemicals and we see if we can smell them. If you can, that means it's not well fit.
And I'm going to go ahead and eat some of the contaminated food, and then the party's over. Because I have to get it, because when somebody goes on intervention, they want to get high one last time. The party ends for me tomorrow.
How is eating contaminated food a party?
I've been eating poop for 12 years.
Oh, she says that? Wow. I think she means it more probably from an aspect of it's aerosolized, it's everywhere. More so than she's actually consuming human waste.
You're getting a high out of thinking that you've got fecal matter in your food.
It's my last blaze of glory.
I mean, it's not about you sitting there and judging her. Like, I hate these shows for this. This is about understanding that this person actually has a condition and getting help. And there's legitimate surveys and questionnaires we can give to patients that are either self-reported or the doctor can fill out or the family member can fill out. These questionnaires and surveys are well validated to come to a conclusion of a diagnosis.
She's very well aware that she could be ingesting fecal matter into her body and getting pleasure from it. That is disturbing.
Why the judgmental statement? It's dangerous or it's not dangerous. It's problematic and we need to act or we don't act. The editorialization of these things is not needed. And in fact, that's when patients pull back and feel judged by providers.
Okay, so look at me. This is the end of you pooping in a bucket. Every time you're gonna go to the bathroom, where are you gonna go?
In the toilet.
Exactly.
I would love to see just a sit-down interview asking the patient some questions. How does she feel about this? What does she understand? What does she not understand? I feel like that's missing in this episode.
What seems to have happened is in living with mom, as mom's functioning started to decline, as the house started to decline, she rolled with the changes and she didn't question it.
When it comes to treatment of hoarding disorder, most of it is focused around psychotherapy, cognitive behavioral therapy, mutual help groups, and there are instances where pharmacotherapy, medications are used, but it's actually not well researched. We don't have good answers. There's no algorithmic treatment plan for it. So a lot of it is targeted at symptoms, at comorbidities, and not so much for hoarding disorder specifically. More research desperately needs to be done on that, and not on patients who have OCD and they're classified as having a hoarding problem, but more so those who have a clear hoarding disorder, which is the new DSM-5 criteria.
I've made a professional opinion that she's not capable of living alone. Not because she is a compulsive hoarder, it's because cognitively she can't live alone. We've got to figure out a plan B.
Getting the family involved is great. Social support is very valuable. It's one of the defining factors of any psychiatric health condition. You could even get social support services and adult protective services involved. But ultimately, in order to tell a patient what to do, they need to lack the ability to give consent, be a danger to oneself, and you need to seek a court order to appoint someone to make decisions for them. This is a lengthy and not easy process because we want to protect patient autonomy and make sure that people don't take advantage of others. So for example, I've had some patients that their family wasn't taking good care of them and I knew they were at risk, but it's not because they were doing something bad to the family member, just they weren't paying adequate attention to them. And as a result, there's not much I can do. I can call Adult Protective Service, they can make recommendations, but ultimately it's up to the patient to accept that service or for a court order to be issued. Medicine gets it wrong. Here's some unbelievable things doctors actually used to recommend. Click here to check it out, and as always, stay happy and healthy.